Hi everyone, it's good to see you all virtually at this conference. Allow me to present to you what I and my colleagues did for the past year. This presentation entitled Empathy in Nursing Student, a Scoping Review. So here is the outline as you can see on the screen. Now, as we all may know, empathy is an essential part of many healthcare professionals. In the context of providing care for patients, empathy refers to the capacity to understand and convey each patient's subjective experiences and points of view. Additionally, empathy is necessary to assess patients' actual needs and provide individualized care, thereby providing patients with holistic, high-quality care. It is argued, however, that empathy can be taught. In nursing, educators are challenged to explore instructional strategies that can aid in the students' development of empathy. There are many studies conducted in the past 10 to 15 years on empathy, but mostly to date, a limited number of review studies have sought to examine empathy in nursing students. To address these issues, a scoping review was conducted on empathy in nursing students. This review aimed to examine empathy in nursing students, including how to promote empathy, factors that contribute to empathy, and what to evaluate in empathy. Here are the key concepts using PCC frameworks as you can see on your screen. A systematic search was performed on 4 databases: Medline with full text, Scopus, ScienceDirect, and PubMed. These study search delimiters comprise student nurses and articles published in English from database 2011 to 2021. Only published studies were reviewed. Due to the nature of this study, an ethical review was not required. 254 articles were retrieved in total. 95 duplicate articles were eliminated, leaving 159 articles for title screening. Each author independently reviewed the titles and abstracts of search results to identify articles meeting inclusion criteria. The titles of 65 articles were deemed irrelevant, and the abstracts of the remaining 94 were evaluated. After abstract screening and application of inclusion criteria, no articles were eliminated, leaving a total of 94 articles for full text review. At this point, each author independently reviewed the full text. In the event of a disagreement, the 3 authors discussed the issue until they reached a consensus. Any disputes between reviewers on the selection process were resolved through discussion. In the final scoping review, the search results and the study inclusion process were presented in a preferred reporting items for systematic reviews and meta-analysis extension for scoping review flow diagram. The 94 papers were thoroughly read and had the main information extracted. The themes emerged in this study were promoting empathy, contributing factors to empathy, and the evaluation of empathy. Now we're going to discuss a few of the results. As empathy is a component of compassion and kindness, it will eventually promote holistic nursing care. As significantly as empathy affects a patient's physical and emotional health, so do educational interventions. This study found that virtual simulations of empathy improve active learning, self-awareness, and practice readiness. Several factors, including personal characteristics, interpersonal relationships, and clinical exposure, can positively influence the increase of empathy among nursing students in the health field, according to results of this review. Empathy is also significantly associated with self-awareness. A study by Haley et al. Found that nursing students can enhance their empathy by incorporating active listening and self-awareness into their clinical practice. Only one qualitative study identified 4 empathy components, which is affective, cognitive, behavioral, and moral, by Patterson in 2020. This necessitates additional research on empathy components. Additionally, nursing students have greater empathy than practicing nurses, according to Lopez Perez et al. In 2013. Previous research contradicted that older professionals and those with more experience possess greater empathy by Gleichgert and Desity in 2014. In conclusion, this study examined 94 studies on empathy in nursing students. The three major themes emerged: promoting empathy, contributing factors to empathy, and the evaluation of empathy. However, some areas of empathy concepts were somewhat limited in evidence levels. A deeper examination of the components of empathy is required. While informative and encouraging, the findings of this review suggest that future research should investigate the educational intervention of empathy in nursing students by considering its contributing factors. And here are some references. Thank you for listening. If you have further questions, please don't hesitate to contact the corresponding author of this project.